Well, welcome back. This is going to be this is the abnormal psychology test 2 information. So draw you a line there under everything with test 1, and you'll be ready to go for test 2. Once again, you know we have a final exam that's cumulative here. It's kind of nice with abnormal psychology. There is no midterm. So that's really nice. So man, yeah, this should be like your favorite class. No midterm in this particular class. Make myself a note of that to be sure and tell them we're doing that. No midterm. The reason that there's not a midterm is we have so many case studies and so many different things that we don't actually have time to stop in the middle. We have so much material to cover that we don't do a midterm. So let's talk about psychological disorder, because there's so many things out there. There's so many things that occur, and people are like, I think I have that disorder, or I think that's, people that study nursing often have this happen. They're reading about this, and they go home and they say, hey dear, I think you have this disorder. We studied this. And so we got to realize that, a lot of times, and we studied developmental last time, we talked about tic disorders, and somebody's like, I have a twitch or whatever, I think I may have Tourette's or whatever, but there are a lot of different things. There's 3 requirements for a psychological disorder, and it's got to meet all of them. It's got to meet all of them. Okay, so here we go. So these are the 3 requirements for a psychological disorder, for somebody to have a psychological disorder. Number 1, it has to cause personal distress. Now this is a tough one, because how many Down syndrome kids have no personal distress? They're happy all the time. So, but we have to define this in terms of being able to function in society. So number 1, personal distress. Number 2, we have to have some type of psychological dysfunction. We have to have a breakdown of cognitive, which is thinking, emotional, or behavior. Okay. So we have to have a breakdown of cognitive, okay, which is thinking, emotional, which is dealing with, or behavior, which is what we see. So we have to have a psychological dysfunction. And the third thing is, it has to be atypical. Now, that means it's not culturally accepted. So it's kind of interesting, because we may go to another country, and they may do something. And we may say, wow, that's really weird, but it may not be atypical. It may be normal for their culture. So, once again, 3 requirements for a psychological disorder. It's personal distress, psychological dysfunctions, including cognitive, emotional, and behavior. And it has to be atypical, not culturally expected. Okay. And these must occur. Okay, we're going to throw one more in there. Okay, this fits in with the 3. We could call it the 4th one, or we could say these have to occur. But the symptoms for a psychological disorder have to occur 30 consecutive days. Wow, 30 consecutive days. So that means that, let's talk about depression. Are we psychologically dealing with depression? We have a whole chapter on depression, so we'll talk about that. But so are we really depressed for 30 days, or do we have moments of depression? And if so, it makes a difference on probably what's causing that depression, okay? Or anxiety, or how about we're going to talk about in this chapter, we're going to talk about personality disorders. We're going to talk about schizoid. We're going to talk about narcissistic, where you're actually just kind of high on yourself. And we're going to talk about paranoid personality disorders, and we're going to talk about obsessive compulsive personality disorders. Wait till you read the case study on some of those. So we're going to do personality disorders, but for it to be a true psychological disorder, symptoms have to occur 30 consecutive days. Okay. All right. So once again, to get that, 3 requirements for a psychological disorder: personal distress, psychological dysfunction, atypical, and it has to occur 30 consecutive days. So that's how we define that. So when we think about that, it's got to be all of those. So that's pretty tough. So we eliminate a lot of things. We'll be like, Okay, now it may be a tricky thing in your life or in somebody's life, and it may be something you have to deal with. It may be like Judy and the blood. It may be a trigger we're dealing with. It doesn't mean she has a psychological disorder. It means she has a psychological trigger that causes her to have associations. Okay, so that's not a, Judy's case occurred where she had it over 30 days. As a matter of fact, she was fainting 5 to 10 times a week. So hers turned into a true psychological phobia. Now, let's move on. We talked about in Psychology 101, in this test, we talk about it again because Freudian psychology comes back into play. Once again, let's just refresh our memory. You will be asked to describe Freudian psychology again on this test. Freud feels like that there's three parts of our inner self, that we have the id, the ego, and the superego. Remember, the id is kind of kid-like, but the id is the needs. The id is the needs. The ego is how we meet those needs, and the superego says, is it moral, is it ethical, and is it logical, the way that we're going to meet this. So once again, just kind of refresh our memory. The id says I need a vehicle, or I want a truck. We talked about that commercial, comes on, truck, got to get a truck, and the id says, I think I'll go get a truck. Well, so the ego says, okay, how are we going to go get that truck? I think we'll just go, there's one over there, it's got the keys in it, let's just go steal it. The superego goes, no, that's not right. We don't steal something. And so it says, okay. Well, I'll get a job and go do it. And the ego says, yeah, you can get a job and you can set aside so much money every month or whatever. And the superego says, I think we can do that. So we have a plan. So in Freudian psychology, we're able to meet the needs of the id. In Freudian psychology, the problem comes when we're not in a balance of the id, the ego, and the superego. That's the problem with Freudian psychology. If the id is too strong or not strong enough, or the ego is too strong or not strong enough, or the superego is too strong or not strong enough, and it doesn't balance the three. So that's the problem. And we talked quite a bit about that, so we won't go into a lot of detail. But I do want you to know, and another question on the test, I'm giving you a lot of test questions on this, but it says, what branch of psychology did Freudian psychology lead into? So the branch of psychology that Freudian psychology led into was actually humanistic psychology. You remember that from Psychology 101? Humanistic says that we can actually, it's free will, that we can actually control the things that happen to us. That we can be anything we want to be. So Freudian psychology says if we have that into balance, if the id says, hey, I want to be president of the United States, I guess it could happen to, think about the different candidates we've had lately for president of the United States. It could have been anybody. Because in Freudian psychology it says, okay, I want to be president of the United States, so that the ego keeps saying, what's your plan? What's your plan? What's your plan? And some of the presidential candidates didn't really have too much of a plan. Okay, no, I'm just joking. They probably did fine. And then the superego, well, you know what? I retract that example of president of the United States because that just doesn't seem to work too good. And the superego, is it moral, ethical, and logical? That just messes up the whole deal. So let's do another one. Okay, let's do another one. Let's say you want to be you want to do something for a particular profession. You want to be a teacher. So you say, okay, I want to be a teacher. I want to be a particular type of teacher, a particular grade. So humanistic psychology says you can do that. So your id says, I want to do that. So your ego says, well, what do I need to do it? And your superego monitors you as you go. So that's describing Freudian psychology just briefly, the id, the ego, and the superego, and then the fact that it leads into humanistic psychology. Now, I saved the next part of this video. This is probably the most critical part of the video. So I love this part because now we're going to look at how we can treat psychological disorders. So there's 4 types of psychological treatments that we can use to treat psychological disorders. So on the test it says name the 4 types of psychological treatments and describe the psychological theory or behavior that they're based on. So the 4 types, okay, let me give you these, okay. We have moral therapy, okay, psychoanalytical therapy, humanistic theory, and behavioral models. So let's talk about what those are. So you'll hear them all again, so as you're writing them down, that's the beauty of this tape too. You can stop it, go back, rewrite it. Even studying for the test, no longer than the video is, 10, 15 minutes, you can go back and rewatch it. So once again, 4 types of psychological treatment. Let's do moral therapy first. Okay, moral therapy means treating a patient as normal as possible. Treating a patient as normal as possible. Moral therapy. So we say to somebody, we don't treat them, we don't back off, we don't treat them as if they're handicapped, or we don't treat them as if they have a problem. We treat them as normal as possible. You know, we don't go in and they say, "Oh, I'm dealing with all this," and you go, "You know what? You'll be okay." Treat them as if they're a normal person, not experiencing a handicap. So, does this work in every case? No, but it is one type of therapy. Is that we try to bypass whatever the psychological disorder is, and we try to just be normal. We almost ignore it. We deal with it, okay, but we just try to treat as if we're normal, okay. It's kind of like why most guys don't want to go to the doctor. They don't want to know something's wrong. They just want this moral therapy. They just want to think that they're normal. Now, psychoanalytic therapy, okay, is a balance of the id, the ego, and the superego. So psychoanalytical therapy, that's Freudian psychology. That's where we look at somebody and we say, okay, what's the problem? Is your id too strong or not strong enough? Is the ego too strong or not strong enough? Is the superego too strong or not strong enough? Okay, so is your kid too strong? Are you just about desires and not about how you're going to obtain them? Or are you too strong on your ego where you're always planning and never getting anything done? Okay, if your id is not enough, then you don't know how to play and enjoy life as well. It's all work. So psychoanalytical therapy is to look at the id, the ego, and the superego and try to get a balance. Then the third approach to psychological disorders is a humanistic theory, okay, which challenges with positive rewards. The humanistic theory says, I can do anything I want to do, and if I do it, here's this positive reward. If I do this, here's the positive reward. Here's this, here's the positive reward. So that's the humanistic theory, meaning that we can do it if we wanted to, so we put positive rewards out there. And then the last one, the behavioral model, this uses classical conditioning or operant conditioning. Classical conditioning, remember Pavlov's dog? We just do the same thing. We put a different stimuli in here. So when we look at Judy, and once again, that's one of the case studies we had earlier, we can look at her and we can say, okay, every time she sees blood, then we associate it with something different. Okay? Remember in Pavlov's dog, they fed the dog, and the dog salivated, and then they rang the bell, fed the dog salivated. Then they rang the bell and didn't feed the dog, and the dog did what? Salivated. So he had the association of food and the bell. So in the behavioral model, we're going to associate something with something else. Now, this is a great approach to psychological disorder, but we have to be careful that our behavior isn't something that's worse than before. So, for example, people did the behavior model a lot of times when they had extreme stress, okay, they might actually smoke a cigarette, okay, or they might, they might use drugs or whatever. But the problem is that then the association is, oh, I think I'm stressful, I need to smoke a cigarette. So once again, the trigger changes. So in the behavioral model, we have to be careful that the behavior isn't something that we have to untrain as well. Okay? The behavior isn't something we have to untrain. So once again, 4 different things. We'll talk about them a lot as we go. Moral therapy, all right, treating a patient as normal as possible. Psychoanalytical therapy, balance of the id, the ego, and the superego. Humanistic theory, with positive rewards, meaning that we can do anything we want to. We just challenge it with positive rewards. And the behavioral model, classical conditioning. Do something, replace it with something else for that stimulus each time, and as we do, we replace the behavior that we don't want. So that's video 1. Basically, when we come back to video 2, we're going to talk about personality disorders, and that will be test 2. So you're doing great. I hope you're enjoying your case studies, and I'll see you in the next video.